Hello and welcome back to episode 2 of this series on SYNLAB Podcast, where we have been discussing how to live well with arthritis. I'm Patsy Mokungah and I'm still your host. With me here has been the amazing Dr. Charles Ifudu, who is a rheumatologist and has been helping us to get to know more about arthritis. Now, in this episode, we're going to be talking about treatment options and expert care concerning arthritis. While we're here, I'd like you to like this podcast, to share this podcast with everybody this information is related to, leave a comment about what you're learning, and subscribe, because we're going to come back to you again and again with more information. Now, back to you, Dr. Charles. Thank you so much for being here, and thank you for all the information you're giving us. Diving right into our topic, I want you to help me explain what the most effective treatment options are for arthritis. You hear about different things. I personally have seen people being treated for arthritis from hot balms to going to bone setters where they'll cut your leg and, sprinkle in, spices. I think they are spices, yeah. But what do you think are the best treatment options for arthritis?
All right, thank you. For effective treatment of arthritis, in fact, the treatment of arthritis depends on its cause. So first, we have, I actually classified arthritis in non-inflammatory and inflammatory. For the non-inflammatory arthritis, of which we will talk about degenerative arthritis, osteoarthritis. I gave an example of osteoarthritis. One, the management is, in fact, the main thing we do there is pain management. And when the pain is managed, it actually prevents functional disability and also improves quality of life of patients. First, in managing pain, we classify into pharmacological and non-pharmacological treatments. Pharmacological is simply means drug treatments. So then non-pharmacological is other treatments you can institute apart from drugs. So for the pharmacological management, usually use analgesics. So, and one of the analgesic, typical example we use is in non-steroidal anti-inflammatory drugs. Examples are the ibuprofen, the naproxen. So those ones, you can take them orally. Then they also have other ones we call opioid analgesics. Example, tramadol can be used to manage pain. Then they also have the topical ones, the topical analgesics, the non-steroidal anti-inflammatory. So it can also be applied topically. Then you can also use other drugs, which we call steroids. You can inject a steroid intraarticular, have intraarticular steroid injections. Then they also have a physical supplementation with a higher uronic acid. So these are the things you can do in terms of drug management. Then for other management, that is non-pharmacological management, I also have a weight reduction for the patients that are, or people that are obese. Weight reduction is advised because it actually puts stress on the weight-bearing joints like the knees and the hips. So they are advised to reduce weight. Then another thing is to use braces, what we call splint or braces for people that have knee osteoarthritis. Then other things like exercises too. There might exercises like walking or bicycle. So we'll discover that this stationary bicycle is also very good. So it helps with joint flexibility, mobility, and even strengthening of the joints. Then for autoimmune diseases, in addition to NSAIDs, some of them, you can give them NSAIDs, which is a non-steroidal anti-inflammatory drug, the steroid. There are a group of drugs we call disease-modifying anti-rheumatic drugs, DMARDs for short. and they have different classes. We have the synthetic ones and the biologic DMARDs. So under the synthetic DMARDs, we have the conventional synthetic DMARD, then also the targeted synthetic DMARDs. So for the conventional synthetic DMARDs, we have like methotrexate, sulfasalazine, leflunomide. Then for the targeted synthetic, you have the phosphodiesterase 4 inhibitor, the apremilast, then the Janus kinase inhibitor, like the tofacitinib, baricitinib, and opazicitinib. Then for the biologic DMARDs, we have the tumor necrosis factor alpha, and like the adalimumab, golimumab, certolizumab, pegol, infliximab, and etanercept. Then you also have the ones that target interleukins, like interleukin 6, interleukin 17, the secukinumab, interleukin 6, tocilizumab. Then the ones that are the B cells, the rituximab. For the T cells, we have abatacept. So those are the classes of drugs we can use. In fact, it makes it simple. When you know the inflammatory and non-inflammatory, it's also easier for you to know how to then, and the ones I mentioned, these are the management we institute.
Okay, thank you very much for that extensive explanation. Now, the thing is, for our audience, right, just because people are hearing these things, and we're in the digital age where you can pick up your phone and just use your phone to go online and run your symptoms by Google. And here we are, we've now given them the list of drugs, right? And so that people don't run to the pharmacy tomorrow and start looking for, I read on SYNLAB Podcast, people should give me this drug. I want you to help us understand the role that rheumatologists, orthopedic surgeons and other specialties in related to arthritis. How do they come in? Where do they come in? How do they play a part? Do you understand? So that our audience can understand why they need to go to this, people to go and help with their situation.
Okay. Yes, the rheumatologists are specialists that are trained in the medical management of arthritis.
Okay.
So if you have arthritis, your first presentation will be to your rheumatologist. So because, some people, when they have pain, arthritis, they discover, oh, I'm having arthritis, is equal to giving analgesics. And you see that these people take analgesics all over for several years. Before you know it, their hands and their joints start getting deformed. They start having some deformities, and their joint starts getting destroyed. So you have to visit your rheumatologist, because the rheumatologists are those specialists that will know what is the cause of this arthritis and will manage accordingly. Thank you.
Okay, so we can hear that I like that you said manage accordingly. So the management is according to how, the thing is doing you. This is just because I don't want our audience running to go and buy drugs that you don't know. I've heard about NSAIDs before now, and we have a tendency to abuse pain medication. Small thing, you've popped it. So we now know that there is a role that specialists play in this. And if you are suspicious of the fact that you have or may have arthritis, the first line of call is your rheumatologist, right? But how about the orthopedic surgeons? Where do they come in? And at what point do you think surgery becomes relevant in the management of arthritis?
Okay, so the orthopedic surgeons, they are specialists trained in the surgical management of arthritis. And before you talk about surgery, there are things you say, okay, this patient or this person needs surgery. When you start seeing deformities, like in the case of osteoarthritis, when it is becoming advanced. So those are the times or the presentations you see, and they will require surgery. Thank you.
Okay, so these presentations are where you require surgery, but now I want us to backtrack a little bit and talk about what the early symptoms of arthritis may be, so that we don't get to the point where we're looking for surgery. What does it look like when it starts to happen? At what point should you think, oh my God, I need to go see a rheumatologist?
Um, the early symptoms usually present with pain. You can also have reduced range of movement,
Okay.
then stiffness. Yes, those are the early symptoms of arthritis. So when the patient starts complaining about pain, you cannot use the part of your joint. There's reduced movement of that. There's joint stiffness. Then later we start having swelling. But the pain and the stiffness are those and reduced range of movement. And those are the early complaints of arthritis.
Okay, so if you start having pain in your joints, or you're feeling stiff, or you're not moving, you don't feel like they're moving well anymore, that's a sure sign that you need to be running to your rheumatologist's office as soon as possible. Okay, so right now, we feel like this is 2025. It seems like the world has revolutionized itself. So much is happening, especially in the medical space and in the science space generally. What do you think are some of the most promising advancements that have been made for arthritis?
I've talked about biologics before. These are one of the promising advancements because biologics are pharmaceuticals we get from biological sources for managed treatment, especially in the non-inflammatory in inflammatory arthritis. So
Okay.
biologics is one of them because these biologics they actually target molecules, cells, or even pathways in the immune systems. So they target in molecules. So those are the one of the advancements. So another one is the cytokines too, inhibitors that inhibits various um, yes, we have cytokines inhibitors like the interleukin-6, interleukin-12. So these ones are actually targeted. They are targeting those inflammatory mediators. Then you also have some therapies like cellular therapies, like stem cell
Oh, the
transfer, then
stem cell
these
treatment.
regulatory cell inhibitors. So those are the promising advancements in arthritis treatment.
Okay, so you would say that there's a lot of progress being made for the treatment of arthritis. In your personal opinion, do you feel like a lot of progress is continuously being made in the treatment of arthritis?
Yeah, yes, that's what I just mentioned. Yes, we have, in fact, in the area of the T regulatory cell activity, those are the things that we now talk about. Those are the advanced things to talk about in the management of arthritis.
Okay, thank you very much, Dr. Ifudu. This has been very, very educational because we have been able to look at the treatment options for arthritis, and I, I for one, have learned that it's very expansive. Even though it may look like it's pain management, is a lot more than that, and there are so many options available to arthritis patients out there, different kinds of medications that are available to them, both the pharmacological and the non-pharmacological. I believe I just got that right. And you mentioned biologics and how that is an advancement for arthritis today. We also learned about the fact that arthritis in its early stages presents with pain, presents with lack of movement, and stiffness in your joints. So you know that when you're looking at these things, you need to be booking an appointment with your rheumatologist. And I find it interesting the fact that we were able to see how rheumatologists, play a part in helping us regulate this, you know, um, illness, so to speak. So you know that even though we have learned a lot here today, you're not now qualified to treat arthritis on your own. Please don't go to the pharmacy and go and start buying drugs, but rather book an appointment with your rheumatologist to help you manage your care appropriately. I'm just very, very intrigued by this topic. I'm learning a lot, and I'm sure our audience is learning a lot. Now I want you to sit tight. We'll be taking a very short break right now. And while we're taking the short break, I want you to, jump on every social media, Instagram, Facebook, find SYNLAB Nigeria, give us a follow, comment, like, and especially for this podcast, we have it on YouTube, we have it on Spotify. You can like, you can comment, you can subscribe to see more health content, and most of all, share it with everybody you know this will be relevant to. Thank you, and see you very soon as we continue talking about how to live well with arthritis.